The angles are okay.
Are we looking beautiful?
Yeah. That's important.
Yes.
Thank you all for being here. So, welcome to the Global Diabetes Insights. It's great to have these global powerhouses, people living with diabetes and doing amazing things in their own countries. So, maybe the first thing that I would do is to ask them both to introduce themselves to you.
Hi, I'm Sana Ajmal. I'm from Pakistan and I've been living with type 1 diabetes for almost 26 years.
Wow, that is great. And maybe Lisa.
Hi, Tino. Happy to be doing this with you. And I'm Nupur and I've had type 1 for 29 years and I'm from India.
Wow, that is all great. Thank you so much for your introductions. I think maybe for so many people that will be watching this podcast, they already know you because I know some of them are just loyal. They are the very same people that usually watch this. So I think for the things I should do in the diabetes community, we want to really bring some motivation to the people that will be watching all these things. So maybe starting with you, Nupur. Like I think maybe with the things that you've been doing, you haven't been diagnosed with diabetes. And it's not like everyone will just go diagnosed and then they start to do something in the community. It's not like that. So we just want to know like why the motivation, where you got the motivation to do what you do now, to work in the diabetes space.
Yeah. So I was diagnosed as a child, and I think in some format, Tino, I was always advocating for myself. I just didn't know at that time that there was a fancy word for it and that this is what advocacy is, because going through school and college, living with type 1 diabetes, there are always some obstacles that come along the way and some points at which, you need something to work for you in a particular way, or you need some assistance or something. But how I eventually got into this space more formally is that I ended up quitting my regular job, talking to a lot of people that live with diabetes, eventually started our organization called the Blue Circle Diabetes Foundation here in India. Long story, but that's kind of been my journey over the past few years.
Oh, thank you. I think almost everybody has got a unique story to what motivated or what pushed them to do what they do. For people like us, we didn't know anything about diabetes. So if it wasn't for the exposure that I got 10 years later after my diagnosis, I don't think I'd be here. I never imagined talking about diabetes or even traveling doing diabetes stuff. Thank you so much for sharing that story with us. So now we'll move on to Sana. Sana, if you could share with the audience brief about your diabetes diagnosis story and what led you to be a voice in the community. And now you're leading one of the biggest organizations in Pakistan, trying to change lives in people living with diabetes. Because if it wasn't for that organization, we could probably have lost so many lives. So what led you to do what you do now?
Thank you, Tino, for the kind words, I would say. So my diagnosis was a bit problematic. I went into a very bad DKA and doctors at that time could not understand what was happening till blood work came in and my blood sugar levels were over 1200 because I had been given a glucose IV drip, thinking that I'm probably dehydrated. Anyhow, long story short, I think what really mattered to me, because this whole thing spread like wildfire in the small city that I used to live in. I kept hearing a lot of comments throughout my teenage and my early, young adult years, where I started to think about how to become resilient to those things. And I took it upon myself to maybe change a lot of these things that happen in the country, because the society and even the many health professionals are not aware of type 1 diabetes. So that's what made me start this journey. It started as a peer support organization and then grew into a national organization that works in 5 key thematic areas and is supporting a number of children, around 1,000 children now across the country, providing them with insulin and education and peer support as well.
Oh, thank you so much. And now I think it merits mostly on the point that we usually say, because we're all voices, like nothing about us without us. And I don't think mostly if it was to be led by people without this condition, it could be where it is right now, because we really understand what it is if somebody doesn't have insulin. Can they really last a day or two? That is just amazing. So thank you so much, because your work speaks for itself. You live with the condition yourself, but now you want to try and give life to those other people that are less privileged in the community. So thank you for all that you do, traveling around the world to make sure that you have everything that people need in your country. So thank you, Sana, for your story. And now for Nupur, maybe the one thing that you might also want to hear. Yes, we understand like India is really a big country. There's so much happening. To understand one of the biggest challenges, what you think maybe should be the priority to change things if you want to change anything. We know that you are leading one of the biggest organizations in India, Blue
Circle Diabetes Foundation.
Blue Circle, yes. You're also a Blue Circle, right?
I am.
Ah, right. What are some of the challenges that you're trying to address? in the country?
Yes. In India, like in Pakistan, there are some common challenges that we have, but one challenge that is definitely to be noted is that of access. We don't have insulin that's freely available through the public healthcare system for people who are living with diabetes, so that's a big one. In bits and pieces, there might be older insulins which are available, there might be pre-mixed insulin for the poorest of the poor. For the remaining people, we have to buy out of pocket. So everything, right from insulin to your pen needles to your syringes, whatever it is, glucose strips. So the problem of access is a big one. But we were talking some time ago, it's not just about the access. And I know three of us are on the same page on this because we truly believe in diabetes education and peer support. So that's another challenge. There are organizations that are working in this space, and what needs to be done is to recognize them and to give them that importance, because that is something that we also struggle with, right? We come to these international forums and we speak about what we are doing in our countries, but somehow when we are back in our country, it's a challenge sometimes to get through doing the simplest thing, Peer support is not an optional thing, it's not a luxury, it is a necessity. Everybody who is living with diabetes of any type should have access to peer support. So that, I would say, is a second challenge. The third one would be about education. We were talking about this again a few minutes ago, that it's not enough to just give somebody the insulin and say, okay, take it, you have diabetes, now go home and use this insulin. There is so much to know. And in my almost 30 years of living with type 1 diabetes, every day I feel like there's something that I can learn more and something that I don't know. So education. And I think the last thing, which is, I don't know how applicable this might be in the Western world, but for us, misinformation, because there are some religious or spiritual gurus or some godmen who will say that I can cure your diabetes, I can give you a herbal potion and I can take care of everything. And a lot of children and a lot of people, they actually believe that, their families believe that, and they die. They don't take insulin. We know what happens when insulin is not available and not used. So that is another huge problem that we are fighting with.
Beautiful. Thank you so much. The major challenge that everybody sees, even people that live in the West, when they are thinking of Africa or thinking of India or the less middle-income countries, they're always talking about access to medication. But as people on the ground, we also see that there are other gaps, although other major topics that are being neglected, like, say, education, which is very important, because even if people have enough of the medication that they need, if they don't know what to do when, it'll be a bit tricky for them to be able to manage their conditions very well. 10 years later after my diagnosis, I didn't know about hypo. But thanks to these conferences, things have moved so fast. Now I tell doctors what these things are. It's not just about for people with diabetes, but even doctors now, they reach out to me. So thanks to all this peer support, and because there's no judgment whatsoever, that is just amazing. So thank you for that point. And now I think maybe to Sana, I believe almost everybody who lives with this condition, who has founded an organization or an NGO to eradicate some of these challenges that we see happening in our communities. In most cases, people share that there are challenges that they faced or there are challenges that they saw in the communities, in the hospital. That is maybe one of the motivations that led them to do what they do. So I just wanted maybe to hear from you, Sana, what are some of the challenges that you see in Pakistan that we Methods in Diabetes trying to eradicate?
I would want to pick this up from where Nupur left and what you were also saying. The first time that I went to a conference was in 2011. It was an IDF Congress, and I went for the Young Leaders Program. And I remember, and this still happens, that every time I go to a conference, something very hard hits home, and that access gap is the first thing that hits home. Insulin access issue, the test strips access issue, the technology access issues, the emotional support access issue. You can't just take that away. The lack of community. I had not known many people with type 1 diabetes before that, though my doctor was amazing and she used to call us in groups and we used to meet each other. But I knew that this peer support thing was very important for me, and I had made friends, but I did not know a wider type 1 diabetes community across the country. Social media was not there in those days anyway. So I came back home and I thought about this, that I need to do this, because I felt so much better understood when I met those young leaders, even though some were from Europe and they had a very different set of problems and were never on the same kind of situation, but they understood. There were people from USA, there were people from Australia, everywhere around the world actually, which some of them understood. Some of them had the same problems, but many of them did not, but they still understood. They made me feel that I could do something about things that were problematic in our lives. So I came back home and I decided that I'm going to start this peer support platform for people with type 1 diabetes. And the first thing that I did was started talking about myself on social media. And that's where people started connecting. I remember the initial days I was being told that nobody's going to come forward. Nobody will tell you about that they have type 1 diabetes because people would feel judged. There are so many myths and misconceptions, so much stigma. But community started growing, and it started growing by the word of mouth, and it started growing by people searching randomly on social media about type 1 diabetes and stumbling upon our groups and our pages. That was the first way. But then within that community, we started finding people who did not have insulin and test strips for themselves or their children. And that became a triggering point where, as a group, decided to do something about it. And initially, we would start, I remember there were 3 or 4 people, and we started buying insulin and test strips and sending that to those who needed them. But of course, it can't be done in this random way. So we decided to form an organization. That's where Meethi Zindagi came into being. And the first project we started was, apart from the peer support that we were already doing, was to start this insulin support program and build it in a way that it reaches the remotest of areas. So we're currently serving over 104 cities and towns across the country.
Wow.
The insulin and the test strips, they reach people's homes. This was one of the challenges. So my father was in the military. I was covered by the military insurance. And the military health system in our country is the best of all. Like, all free systems, it's the best.
Yeah.
I absolutely hate it going to the hospital, waiting there for the prescription and then my insulin all day long every month. One of the reasons why this model became the way it became was that as a group, we wanted to take away the costs in terms of time, or at least reduce it. So we still require the children that we support to go to their doctors and send us fresh prescriptions, have a follow-up every 3 months, but it does not need to be done every month. So it's like 3 times lesser.
Yeah.
And the time period is also lesser because they just need the prescription and not to wait there in the second line for their to collect their insulin and test strips. And the second reason was we wanted to make sure that everyone in Pakistan could benefit out of this program. So it's not limited by geography. It's not limited by, like, we have a center here and we're just serving this area around us. We make sure that we reach anyone who's in need anywhere in the country.
Thank you so much, Sana, for the motivation. I think because you share one thing in common, you all run organizations in your country and you're trying to cover some of the challenges that you're seeing, some that you've identified. I just want to register a pharmacy so that people can also get to buy insulin at least at a costy price, not the market price, because it's a bit tricky. Even for $5, other people still struggle to get it because they say it's expensive. There are other people that can, even with their pocket money, they can buy insulin for 5 years. But there are those that cannot, even with everything they have home, they cannot even buy insulin for next week. So our challenges, they differ because of our backgrounds and all that. So thank you so much for starting and running organizations with the passion that you have. You also live with diabetes, but you're also trying really to give life to others. So which is good. We need those kind of help because if we don't have it, I don't know where we would be right now. So yeah, I think thank you so much for that.
Yeah.
We are done with the personal story.
Yeah.
Now we are moving on your professional insights on diabetes and everything that you've been doing, like the global advocacy work. Welcome back to the second segment of our podcast. Now we'll focus more on the advocacy work that Sana and Nupur are doing. The question that I would want to ask you, Nupur, is what has been the most impactful advocacy campaign that you've led, or there's something that you've been part of in your country, in India or globally?
Thank you, Tino. It's not a particular advocacy campaign specific one, but just the ongoing idea of having a peer support group and recognizing it as an important part of a person who lives with diabetes as part of their journey. I think previously when I was diagnosed, there was very little to no importance given to groups like ours where people could come together, they could talk to one another, they could learn from each other. And it's changed my life for the better. It's made people around me also have a positive impact in their lives. A lot of people come up to us and tell us that I can now talk about my diabetes at school, at work, with colleagues. There's a certain amount of stigma and shame that comes along, especially in certain parts of the world like ours. And I think having an ongoing support system really makes a huge difference. So I think it's been something that's been going on from the years, but it's an ongoing process. It's not something that was just a one-off thing.
Oh, thank you so much. Like you said, peer support is not something that you just do and then you get over with. It's something that you have to continue to do.
Exactly.
We want to learn from people who have lived it, or people, especially, let's say we're talking about menopause, for example. We will be learning from people who have gone through the process, not learning from people who have just learned it from the book. That is not really how it works. We need to learn from people with experience. Lived experience is always the talk of the moment right now. So now that the community is being involved in so many things, so many conversations. So yeah, thank you so much for that. So now I think we'll move to Sana, and maybe would ask you again from the perspective of advocacy work that you've been doing and do continue to do. So like your work, I think, yes, of course, it has empowered so many people living with diabetes in Pakistan, where you're based. What key initiatives or projects are you most proud of, and why?
I think, I would echo what Nupur just said. There are a lot of things that we've done. Like, for example, the insulin support program. We're doing digital diabetes education. I'm traveling the world, talking to major key players and advocating for the change that we want to see. But I think at the root of all of this is the peer support and the power of the community, which is so very important, because till the time you don't hear the voices out, and as you said, nothing about us without us, like till the time the voices of people with diabetes are not around the table, nothing that we do can be meaningful enough for the people we are doing it. So I think the most important part of my advocacy journey has been the power of the community, like talking to people, knowing what they need, trying to co-design everything that we do, think through the processes together, think about the outcomes together, and making sure that everything we do has the power of the community behind it. Also, the co-governance part, like it's not just about the participatory decision making, but also making sure that we're governing our processes, our projects in a way that the community is involved in that governance. So that has been, I think, the most important success of whatever we have done so far.
Oh, thank you so much, Sana, for sharing that with us. You, as a person living with diabetes, and also you understand like why you need to co-design everything with them, not just making decisions for them and deciding things for them. You need really to go to them, offering what they need, not what you think they need, because you could be seeing it in the perspective of, maybe I would like to use the word fortunate enough. If you're looking at it in those perspectives or in those frames from a fortunate position, it could be different on how people
That's
perceive
exactly
it and what is really important to them.
That's exactly because if we are not diverse enough, if we're not inclusive enough to have voices from various kinds of backgrounds, various cultural dimensions, etc., coming in, it would always be something that we feel is right and that may not be representative of the community. So, and that's what actually brings in tokenism, when we say that we did consult people with diabetes, but then there's just this one person or two people that we're consulting and they're not really representing the wider diverse community. It doesn't actually make sense to me personally.
Oh, thank you so much. I think you really echo with our former IDF president. I think these are some of the things that he was saying to say, because we might have representatives from even low to middle income countries, but they're just coming maybe from the urban area. The issues or the problems that they see and how they perceive their interpretation on what they see, like what they think is needed in the villages, is really different. Now, this is why one of the major reasons now IDF is now welcoming individuals to become members of ITF, which was another thing. So this is now the narrative to say we really need to involve as many people as we can, because maybe they might not be part of an organization that is maybe a member. And for them to be heard, usually you would see only the president of these diabetes organizations invited by IDF. So I think now we are really trying to change the narrative to say what could be missing. Because we've been discussing all these things. And some of us, we really go wary to say, we've been doing so many meetings. We're meeting in Switzerland, we're meeting there, but what is the change? We are not seeing anything tangible. So it's another thing to do so many meetings. And it's another really to implement whatever that is you're discussing. People grow so tired to say, okay, fine, what is the meaning of it anyway? So, but really we need to get the things moving so that whatever that is you're discussing, we could be seeing the changes, because people depend on it. We depend on it. And our communities, those that we say we represent, if they're seeing us, they should be saying, okay, fine, Nupur is trying, Sana is trying. So anyways, that is just about it. And maybe the last question on that vote is maybe that I would have to ask you, Nupur, what kind of advice would you give to those other upcoming diabetes advocates that want to say, or maybe call themselves diabetes advocates? Who is a diabetes advocate?
That's such an amazing question, Tino, really. I wish that there were more people that I knew that I could sort of look at and think that, okay, here's somebody I can ask, what does it take to be a diabetes advocate and what can I call myself? So somebody, I have to share this. A few months ago, a young person, wonderful person living with type 1 diabetes, they came and asked me, and we hadn't met before, and they came and asked me, how do you become a diabetes advocate? I want to become a diabetes advocate. And I found it so sweet and so endearing, because I asked her, do you care about people living with diabetes? She said, yes, I do. I said, do you connected with diabetes in some way? Do you have it? So she already said, yes, I'm living with type 1 diabetes. I said, do you want to make a difference, or even a small difference? And she said, yes. So I said, well, congratulations, you're already a diabetes advocate.
Wow.
You don't have to start an NGO, and it's not necessary. That is one way of doing it, and that takes up a lot of time. And I know Sana will agree with me, right? You have to make sacrifices of your time, of your family, life, of your career sometimes to do more intensive things. But I think I would say two things. Find your why is one. Why are you doing this? What is it that you want to change? And we all come from such different spaces. I know that Sana, when I saw last year Meethi Zindagi reaching out to people in areas where there was a massive flooding, that could be one way of looking at it. Other friends around the world who are advocating for more technology to be available to people who are living with diabetes. So, find your why, find what is it that drives you, what is it that you're passionate about, and pick it up and push through. That would be the first thing. And the second thing, which a lot of us are guilty of, I'm sure, and we all forget, as an advocate, take care of yourself. We sometimes forget to take care of ourselves, and you were saying
Our smiles say it all.
yeah. We are doing these 20-hour flights, and I know it took you 25 hours to reach New York. Sana and me also, it took us almost the same time to get here, and I think make some time for self-care, because you can only pour when your cup is full. You cannot pour when your cup is empty. And so unless you take care of your health and of your mind and your body, there's not much that you can give back to the world and to other people with diabetes.
Yes, thank you so much for defining advocacy in that way. When people see other people running NGOs, they'll think, of course, if I want to become an advocate, I would have to run an NGO. If I see people writing blogs, then it's all about writing blogs. Then who's going to read it? I don't have a specific definition for advocacy, but it's how you define it. What is it that drives you? What do you like doing? And what talents do you have? And then how can that impact other people? Even if it's one person, it doesn't have to be 100 people. Like when you look at Sana, because she has an organization that is reaching out to over 1,000 people, then you say, okay, fine. If Sana has an organization that is supporting maybe 200 people, then I have to be doing that too. Maybe you start with one person that is closer to you.
Yeah.
Empower yourself first, and then if you're empowered enough yourself, then you can empower others. You cannot offer something that you don't have yourself.
Exactly.
If you don't have that experience, you cannot do that. So start with what you have, right? So I think that's what I learned from what you're saying. Thank you so much for that, Nupur. And now I think maybe on you, Sana, maybe you're an advocate. You sit on boards for so many organizations. You've been an advisor to so many other organizations, like I know for ISPA, you've been a peer reviewer. You've written some other guidelines with ISPA together, and you're doing so many great things. So you as an advocate, how do you ensure that your work reaches and resonates with those underrepresented or those marginalized communities that are affected by diabetes?
I try to talk to people, I'm very open. What happens is generally when you get busy, you close your doors to conversations. And that's something that I've tried to not do. I need peer support myself, for example, right? So when I'm very tired after a long day at work, after a hectic meeting or something like that, the first place that I go back to is our peer support group. And then I start reading through the posts the questions that people are doing. I start responding to them. I converse with people. And that's probably what gets me the insights from diverse perspectives about what people are facing and what. I still can't say that I can represent everyone. I can't. I'll be truly honest that nobody can ever represent everyone. But yes, I think the best that we can do is to try to understand things from a different perspective without having this desire to solve everyone's problems. Sometimes you just need to be that sponge that's absorbing everything and trying to internalize everything and trying to see things from a different perspective. You don't have to provide a solution to every problem right away. Rather, understand it from diversity of perspectives, from various kinds of situations before you can actually say that, okay, fine, now I understand this problem and I think that this can be one of the solutions. What do you people think?
Oh, thank you both for being so humble in that way. And I cannot solve every problem. I cannot represent everyone. But I'll start with the little I have, trying to be like a sponge, trying to understand the problems. But really, you cannot be liked by everyone because other people will hate us. Why is she on the spotlight? Why is IDF always identifying Sana? Why is she being called to attend meetings? Why is she now representing? They will say, of course, because organizations mostly, they'll try to work with people that they've seen doing something because we want to work with people that we know. We should not be convinced, I want to be on the spotlight. I want to do this, I want to do that. But if you're just shining on what you're doing it so well, be good in your craft, then things will just fall in line, right?
I think, I have an opinion on this, and forgive me for that, but Often people, for example, ask me, oh, you have traveled so much around the world. You were just going there, coming from there, you're always on the go, etc., etc., etc. So many people want to be diabetes advocates because they think that this is some gift, this is some kind of privilege, when it's not. Because I remember a time when my kids were younger and I would be booking the last flight out of country and I'll be booking the first flight back in. I'll be going from the airport directly to the meeting and making sure that I am on the first flight back. Out of the so many countries that I've visited, I can hardly say that I've spent maybe a few hours visiting the city itself. It takes a lot of hard work. It takes a lot of hard work. It takes sweat. It takes toll. You probably need to see the Sana or the Nupur 10 years ago, and it was not the same. You yourself has put in hours and hours and hours of hard work. Everyone has their own way of being recognized. Some of you might be recognized within your local communities, which is again an amazing thing. I mean, if you're recognized within your local community, some might be recognized better in an international community. When we really want something, we really have to put effort behind that. And when we do, things start falling into place. If you really want to advocate on an international level, maybe start thinking today that what is that international problem that you're trying to solve and what's your pathway. Like Tino said, that there's no one way size fits all thing, but then think about how to make it work, and you'll also get the chances to travel.
This is just natural. So thank you for that. All these things, they come naturally, right? Not like we'd figured out to say, if I start doing this, I'm going to get these opportunities. Yes, of course, it's amazing. It's a privilege to be traveling. We never imagined we'd get much recognition internationally than I do in my own country. Outside there, that's where they think, wow, Tino is actually a resource that we could work with, not used because I don't want to be used. And locally, now they are seeing it now. If Tino is getting recognized by WHO, then I think we should be also calling him. We need him. We need WHO to see that we're working with, which is a win-win situation, because I mean, I wouldn't want to get involved in things that I don't think I'm going to be respected or recognized. If I'm contributing something, then they have to take whatever that is I say, right? That's how things go. So it's all about advocacy. Thank you so much for that. On top of that, like on advocacy work, now I have combined questions. Now we are moving on to the third segment of our podcast. We're saying that we don't want people to fight. We don't want to do competition. We should work together. Yes, we may not like what I do. We need to set our differences up because we're trying to represent ourselves and the other people that may not have the voice to use it like we do, and people that might not get the privileges like we do. You as advocates, you champions, so many people know you. You have inspired so many people in doing great work. How do you use collaboration? I think this is something that I really believe in, that we need to collaborate, we need to work together. I don't know how you see collaboration within the diabetes community, particularly between researchers, advocates, and people living with diabetes, shaping the future and support. So this is a question for you all.
In a euphoric world, in ideal situations, this collaboration should just happen naturally because we're all working for the same things, right? We're similar things. At the end of the day, we all want to improve lives of people with diabetes. That's what whether it's a researcher, whether it's an advocate, whether it's an organization, that's what we're all trying to do, or even pharma companies or anyone else. The reason why people don't collaborate is, all of these people don't collaborate, is that we somehow begin to see each other as competition. And that competition is generally for the small amount of resources that are out there. So most of these parties might want to stand out to be able to access that pot of resources, to be able to do their work. And every work is important. So that's where collaboration starts disappearing. But we also need to understand that when collaboration happens, we are probably not reinventing the same wheel. We're not doing similar things in silos. We're working together and we might actually be able to reduce costs and increase impact if we collaborate. So it's important that we collaborate, but it has to come from the perspective of whoever is providing those resources. Generally, the resource is coming from a very small group of organizations or companies. So probably those organizations and companies really need to think about how to make sure that the various initiatives that they fund is somehow also collaborating with each other, so that again the efforts are just working in silos but in similar ways, and some of those resource providing organizations also need to collaborate with each other on this.
Thank you so much. Beautifully said. I think before I comment, Nupur, would you have anything to add on that?
Just that I agree with Sana. I think when everybody's new in the journey or at a certain point, it always does seem like everyone's rushing towards the same, she said, pot of resources. But we have to understand that only by coming together will the pot grow bigger. Only when we all can join hands and work together is when things will improve for everybody. So I just want to reiterate Sana's point on that and 100% back it. That's the only way forward.
Wonderful. You have beautifully said it. maybe we would have to move a bit, focus on the diversity of work and the equity and inclusion of diabetes care. And I'll start with you.
Yeah.
From your perspective, what is the current state of diabetes care in those underserved communities? And what actionable steps do you think can be taken from the global community to ensure that no one is left? What do you think should be done?
I think that there's a lot to be done in terms of reaching out to the underserved communities, because we were speaking earlier, it begins with access, and a lot of places people don't have access to insulin, which is essential to life, and somewhere we need to make our governments understand that for the low and middle income countries, majority 70 to 80% of our population will face the brunt of non-communicable diseases, so be it diabetes or any type of diabetes or other conditions as well. I think it's really important for governments to realize that and to work together to be able to make it a reality, because in an ideal world, we want everybody to have the best technology. We want them to have insulin. We want them to have unlimited test strips, CGMs, everything. But on the ground, we know that the reality is different. Not all countries have the same amount of money. Not everyone has the same support. There are different problems related to stigma and other things which are more prevalent in certain parts of the world. So we have to work with what is there on our plate. And to make that happen, again, this is something we all, the three of us and all the other advocates, our friends, also say that nothing about us without us, right? We must have people with diabetes on the table when these decisions are being made, because we are the people who are living through this. We are the ones who are going through this journey, and no one knows it better than those who are living through this. So bring those voices as well to these conferences and to these forums here, where people that may not have had an opportunity to come before, people that may have had different types of challenges, I think it's our job as advocates also to give them that space and to make that platform available for them.
Wonderful. From what you said, there was something that I even discovered before I had done a research. I always thought if these are some of the challenges that I think are just natural. But when I engaged into research on the things that I wanted to find out, what I was assuming is a bit slightly different from what they need. You cannot assume what people need. You need to learn from them.
Yeah.
Let them speak. Of course, you can be their voice, but first you have to reach out to them. We take baby steps. So I don't know, Sana, would you want to add anything on that?
Language sometimes becomes a big hurdle in these international forums, and not, for example, if I talk about Pakistan, not everyone can speak English, or not everyone might be confident. Even if they do understand, they might not be confident enough to converse. And I'm sure there's similar issues in Africa, there's similar issues in India, and so many countries around the world. So probably a national level convergence and inclusion of these diverse voices needs to happen. A regional level convergence and inclusive approaches need to be taken up at a regional level, and then, of course, international level as well. That will also help the advocates who, for example, go to the international forums, understand the actual local context better. So in my opinion, this would be something as a top priority to ensure diversity and inclusivity within country, and even when we go and speak at the international forum.
Thank you, Nupur. Thank you, Sana, for that. Getting like this emphasis and these robust responses that you're giving to these things. And I believe that these will motivate even the listeners. People will be asking questions because we might not have answers to everything. So that's why usually we need to come up together to just let them get fine. From your perspective, or from your angle, from Indian perspective or Pakistan, what is it that you're doing? Some of the challenges are unique. We may not be facing the same things because we have different resources. We have different priorities in terms of our policymakers. And then that takes us to our next question. Dale, I think I'll start with you, Sana. How can this diabetes community better engage policymakers? We as diabetes community, how can we engage these policymakers, ensure that the diabetes receives the attention and the resources that it deserves on a global scale?
By speaking out. The challenge I'm sure so many people around the world, so many advocates around the world face with the policymakers is how to get their attention, right? You can't get a policymaker's attention till the time he or she feels that this issue is important to a large number of people who are their constituents. So you have to get that voice behind it. This is one way of doing it, to maybe start speaking about it, build the community, more people will start talking about it, write in the media, write in the newspapers, talk about it in the media, not till a policymaker actually understands that this is an issue that is affecting a large community, will they pay any attention to that? The second option can be for some people to do some research work on the policy that exists and how that impacts. So you gather data that supports whatever you want to change, that supports your narrative. Gather data to first identify that if actually this is an actual problem and this is an actual solution, or it's just your thoughts. And if you do find that data supports your solution, or at least shows that this problem exists, you can then go and meet directly the regulators and the policymakers, write about it again in the newspapers, write blogs about it, then get the voice behind you to support that. Policymakers have generally got so much to deal with that they won't pay attention till the time you either have data to show or you have the community force behind you. So in my opinion, these are the two ways to get their attention.
Wow. I concur with that, because I remember using this way. Data is the talk of the moment now. So if they want really to draw anyone's attention, you need to show them like how many people have been impacted. I think the way COVID-19 has woken people up, I think it should have been a learning curve for so many people, like how it claimed so many lives, even for the changes that happened in Zimbabwe, which were amazing. And so many people learned from that, was the HIV movement. We have a policy in Zimbabwe, which we call the National AIDS Levy. Every taxpayer in Zimbabwe contributes to that. So people living with HIV in Zimbabwe, they don't pay for medication. They will actually be contacted. If we know family members from a family, person X is not coming to get medication, can you please encourage them to come? They're actually being told, they don't want to do it, but they're actually being told to be asked politely, come get your medication. So policymakers really, if they see that there's an attention, why was that the case? They addressed it suddenly because the policymakers that were working at the time, they were impacted by HIV. That's why they acted, need to address this issue. Otherwise it would impact us when we're out of office. So they had to do something. So many countries are learning. Zimbabwe, it's actually a case study on how they did so well to manage HIV. I don't know, Nupur, what would you have to say?
I think both of you have really raised some amazing points, and I agree with those points. Also, a lot of people said that when COVID came in, all governments around the world, whether they were from high-income countries or from low-income countries, all governments swung into action. The vaccine got ready, and there was immediate action taken because lives were being lost. And we don't see that urgency for diabetes. We don't see it. We have been screaming ourselves hoarse for years. There's something that we as advocates need to change in our strategies when we are engaging with policymakers, because clearly COVID has its own importance and people were losing their lives and it was a pandemic, nothing less. But what's all happening with diabetes is that so many people, and the numbers are only increasing, and governments are going to have a problem years down the line when those people don't have the right access to medicines, when they don't have the right education, when they don't have the right peer support, and those people, God forbid, they develop complications. Who's going to take care of them? Who's going to pay the bills? So I think we need to make our policymakers understand the importance of, it's not a short-term goal, it's a long-term goal for the benefit of the country.
Thank you so much. That is amazing. So this is something that we need to listen on. This is the last segment of our session on empowering the next generation. Start with you, Sana. How do you see the next generation for diabetes advocates and the healthcare professionals shaping the future of diabetes? How do you see that happen? With all these changes, now people with diabetes are now invited. They are being given a seat at the table. Now they are speaking through the Digital Voices, for example, to participate on symposiums. How do you see it now moving forward?
For example, DDoC is a great initiative. Initiatives like these need to be encouraged, because when you come to conferences, my reality check was for the first time was when I went to the IDF conference in 2011. So that was a moment of realization for me that I really needed to do something, and also learned a lot from the other people, the other sessions that were going on, the people that I met. That's amazing to people come to these conferences and learn, network, and find support as well. But at the same time, what we really need to do as well is to nurture these advocates at home. We need to nurture these advocates nationally, regionally, and internationally at all three levels. And that's where probably the gap exists. So DDoC is fulfilling that gap at an international level. And I know that Breakthrough T1D is doing something like this in India to make sure that all the advocates come together, they're nurtured, they get to learn from each other by networking with each other. So these are the examples that should be used in every country to make sure that you're nurturing these advocates and ensuring that, for example, IDF's member associations, for example, any other diabetes organizations in our countries also start adopting this practice of making people with diabetes sit on the decision-making tables. And not just one or two, but loads of us need to be out there to be able to actually represent the community.
Wonderful. Thank you so much. Thank you so much. For you, Nupur, what are your hopes, on top of what Sana said, what are your hopes for the diabetes community moving forward? What advice would you give to those that are just getting into this space to do advocacy work? I mean, if you could share with us your biggest hopes for the diabetes community, what do you hope to see?
The larger hope is to be able to have an opportunity to not have condition, to be able to find. And I know there are so many organizations that are working on this already. There's Breakthrough and there's so many others that are doing great work. But in the meanwhile, in our lifetimes, for people to have the support that they require, for them to have the insulin or the medication they need, for them to have the right education, because really nothing can be done without knowing how to manage your condition, for them to have the right support from the community. I think these are non-negotiable things. Whether there's a child or a young person living in a village, or there is somebody living here in New York, they both equally deserve the same level of care, at least the basic level of care that anyone around the world should have. So that's my hope for the diabetes community. Where you live and where you are born should not determine whether you live or die. We all have the right to live. That's really my hope for the future.
Oh, you said it so beautifully. So thank you so much for that. It hits home. It's where you live and where you are. I think now even so many organizations are using that knowledge. This is what we want to release, especially for people who are in England. They have everything they need. If they need CGM, they can use it. They have so many other things. But for us, we're still struggling to figure out how, if they can get hold of their medication for tomorrow, it's still a struggle, depending on where you are. This is the reality now. But I think this is something that we hope to see change in the future. So because we don't want that. Because I shouldn't have to move from Zimbabwe to go to the UK so that I can get proper medication, proper treatment, and every other steps that I would need. So, well, which is just something else. I think the last question that I have for Sana, and then I'll come back to you with the last question. Looking back at your work, you do so many things, like we've always been saying. What do you want your legacy to be as Sana, you yourself?
I think the biggest achievement for me would be if our government starts a holistic, universal healthcare program for all people with type 1 diabetes and all people with diabetes as well. Not just for type 1 diabetes, but because my whole work revolves around type 1 diabetes mainly, I want to see insulin access for all. The government stepping in either through public pharma or through any of the support initiatives or through subsidies to ensure that insulin access becomes a reality for people with diabetes in Pakistan who need it. I think that's what I want my legacy.
This is amazing. If people can have access to the things that they need, I would want that to be my legacy too, like in my country. If people can have the same access that people with HIV are living with, that would be enough. Like if people can get medication, that's enough for me. And then we can always start to do education, and then we can try to empower each other with our experiences. But if people get medication that they need, because this is something that you have to pay for. But education usually comes for free anyway. Even if we're doing camps in Zimbabwe, we don't ask people to pay anything. They just come for free. If we're doing workshops, they come for free. So which is good. But medication, you have to buy out of pocket or through insurance, but not so many people do have it. So now I think last question for you, Nupur, would be like, if you could implement one major change in diabetes care or advocacy tomorrow, what would it be and why?
I think globally, one change would be that now, of course, we are noticing that there are places at the table for people from everywhere. It's not just from certain countries or, the Western world, but people from all parts of the world are being invited. We are here in New York. So that's the step one, platforming those voices that have not usually had an opportunity to speak. And I think at the country level, the one change that I would like to see is for everyone to know that it begins and ends with you. Of course, you have a team for your support, you have healthcare providers, you have the government, you have fellow advocates, you have other people in the community, but the buck stops at you. This is your body. Please take care of it. Sometimes we don't realize, I wish I knew this when I was young, that we forget that, or we are not told that what can happen if proper care is not taken. And those are hard-hitting facts. And I want for people to remember that, not be scared by it, but remember it and take care of themselves.
Wonderful. Thank you so much. I wish I could clap hands for you all, but thank you so much.
But we can clap for you.
Yes.
This was amazing. I don't know if you have any last words or shout outs that you'd want to give to the people that will be watching, or even to your community. I don't know if you have any last words.
I would say be the change that you want to see, and it will happen.
Okay.
Thank you, Tino, for having us, sharing our voices on your podcast, and you're doing a great job putting it out there and getting the word out to people. I think it's a very crucial thing that you're doing.
Oh, thank you so much all for being part of this. Takes a lot. You have other things to be doing, but you chose to be here. So thank you so much. I'm humbled. Even the diabetes community would be motivated, and this is something that is going to stay there forever. And many thanks to Breakthrough T1D for giving us the space to do whatever that we wanted to do, however we wanted to do it. But yeah, I mean, it was so great, and thank you so much for being part of this podcast. And we hope that the diabetes community will be inspired, encouraged, or even motivated to do things and just continue to lead your journey. You don't have to compete with anyone. Let's just come together and reach out to us, reach out to them if you need to, if you want to get motivation. The door is always open. So yeah, thank you so much for everything.
Thank you,
Thank
Tino.
you.
Thank you so much for having us.
Yeah, thank you.
Thank you.
Wow, this was great.